There are so many health professionals who can diagnose and treat attention deficit, hyperactivity disorder, ADHD, that finding one can feel overwhelming and confusing. Before you start looking for a doctor or healthcare professional, be clear what your goal is. Do you need an ADHD diagnosis? What type of treatment do you prefer? For example, are you looking for a professional who can prescribe medication, or for someone who can teach you or your child practical ways of coping with ADHD? Knowing what your goal is will help to make your search easier. Professionals who diagnose ADHD. If you're concerned about whether you or your child might have ADHD, the first step is to talk with a healthcare provider to find out if your symptoms fit the diagnosis. There are several types of professionals who typically diagnose ADHD. Physicians are usually the first person you'll contact regarding an ADHD diagnosis. All of the physicians on this list have either a Doctor of Medicine, MD, or a Doctor of Osteopathic Medicine, DO, degree, meaning that they attended medical school. Psychiatrist. Psychiatrists are medical doctors who specialize in diagnosing and treating disorders of the mind. They are typically knowledgeable about other conditions that can coexist with ADHD, such as depression and anxiety disorders. Pediatrician, general, although qualified to diagnose ADHD, these physicians might not have the time to do an extensive evaluation. Developmental pediatrician. While general pediatricians deal with all aspects of children's health, developmental pediatricians specialize in developmental and behavioral issues, such as ADHD, autism, and various learning disorders. These specialists are an excellent source for an initial diagnosis. Family doctor. These physicians are qualified to diagnose ADHD, however, they may lack the extensive knowledge of more specialized professionals. Some may feel more comfortable referring you to other experts in their network. Neurologist. A neurologist is a medical doctor who specializes in the brain and nervous system. A neurologist uses brain imaging and physiologic testing to find out if the ADHD symptoms are due to ADHD or another medical condition in the brain. 1 Psychologists. A psychologist has an advanced degree in psychology such as Doctor of Philosophy, PhD, or Doctor of Psychology, PsyD. Psychologists have a doctorate degree and are addressed as doctor, but they are not medical doctors. State laws for licensing psychologists vary. But in most states, psychologists can diagnose ADHD and other mental health disorders, but cannot prescribe medication. Nurse practitioners. Nurse practitioners, NPs, are registered nurses who have earned master's or doctoral degrees in a specialty area of nursing. NPs with a specialty in psychiatry can evaluate and diagnose ADHD, and other mental health conditions, in children and adults. A NP can prescribe medication. Counselors. The term counselor covers a broad spectrum of professionals who have specialized training in particular types of therapy. Licensed mental health counselors, LMHCs, and licensed professional counselors, LPCs, are qualified to complete initial assessments and provide a diagnosis of ADHD, but some refer patients to a psychologist or psychiatrist for a more in-depth evaluation and/or to prescribe medication. Professionals who treat ADHD can be treated by any doctor who has continued their education on ADHD and mental health. However, only certain medical professionals can prescribe medication. These include physicians, including psychiatrists, pediatricians, family doctors, and neurologists, and nurse practitioners. Physician assistants, PA, can also prescribe if they are working under the supervision of a physician. In addition to these professionals, there are others you can go to for ADHD treatment. While they are not qualified to prescribe medications, these experts can provide other forms of treatment. Psychologist. In addition to diagnosing ADHD, clinical psychologists are experts in providing psychotherapy, including cognitive behavioral therapy, CBT, and family therapy. Occupational therapist. Occupational therapists are trained to address skills needed for a child to be able to function in their daily life, such as self-regulation, executive functioning, and interpersonal skills. Speech and language pathologist. ADHD frequently co-occurs with language impairment. A speech-language pathologist can assess communication skills, develop an individualized treatment plan, and provide therapy to assist in achieving full potential in terms of language use and communication skills. Behavior therapist. These mental health counselors can provide individual and group therapy to work on strategies to manage or change behavior. Educational specialist. These specialists teach techniques for succeeding in school in addition to helping children obtain school accommodations. They may also teach organizational skills. How to choose the right specialist. The best mental health providers are well-trained, non-judgmental, and communicative. If you are an adult with ADHD, ask if they have experience with adult ADHD. If you are looking for a professional for your child, inquire about their experience with kids and ADHD in children. Your doctor or team should be able to answer your questions, discuss your concerns, and evaluate your needs. Find out who specializes in the treatment of ADHD in your area. While it would be convenient to have one professional that meets all of your needs, often you will have a small team of professionals. Each professional will give you the knowledge and the skills you need to excel. If you have narrowed it down to a few experts and still can't decide, go with the one with whom you feel most comfortable. Having a good relationship with your doctor and health professional is also beneficial to treating, managing, and living well with ADHD.